As South Africans gear up for the festive season filled with excitement, fun and of course family gatherings, the South African National Blood Service is launching its annual summer campaign. Now, recognizing the increased demand for blood products during the bustling time, SANBS is unwavering in its commitment to a safe and sufficient blood supply across the nation's healthcare system. The SANBS summer campaign has a mission to raise awareness about the importance of regular blood donations, but also encouraging first-time donors to make donating a lifelong practice, and also educating the public on the reciprocal benefits of giving blood. Now, joining us virtually to tell us more about this is the South African National Blood Service Senior Manager Communications and Brands, Thandi Mosupye. Thanks so much for your time and welcome to Morning Live, Thandi.
Thank you very much, Sakina, and thank you for having us as a South African National Blood Service.
So let's start by talking about the summer campaign for 2024 going into 2025, and also why the festive season drive is so important.
Okay, thank you very much. The summer campaign is really a continuation of what we started last year with We Are the Pulse. And We Are the Pulse was really an indication of trying to teach the South Africans in terms of blood donation. If you remember, when you donate, we've got the gesture, which is the pulse, where you actually get pricked when you donate. So this year we're looking at talking about pumping that up, which means that increasing, collections and increasing people that can come and donate. And it is important, particularly at this time of the year, because as you know, throughout the year, we talk about the challenges that we have from blood collections, one of which is the fact that we collect a lot of blood through school awareness or through school campaigns. But as you know, that the kids are now gone on to exams, and most of them will be finishing in not so long from now. We do have those challenges where our scheduling and collections at schools is compromised. Varsities are also writing exams, so we are not able to go into those particular spaces. Companies and organizations where you also collect, they are busy with some year ends and things like that, so they are not able to accommodate us. But again, I think one of the other challenges is just the high demand of blood products at this particular time from our medical or from our health institutions, where you find that most of the health practitioners might be going on leave in December, and therefore a whole lot of operations are actually kind of scheduled at this time, which then increases the demand for blood. But also being the festive season, we know that we are prone to a whole number of incidents and accidents where people are starting with celebrations and, accidents on the road, can also lead to us having a shortage in terms of blood.
Thandi, what levels of blood supply should we ideally be at, and where are we currently sitting?
Okay, the ideal number that we would like to have is 5 days of cover. And at this point in time, if I just look at yesterday's numbers, we're at about 4, which is not that bad, but we know that going into now towards the end of November, that really does get compromised. As I said, school kids going on holiday and so forth. So that number tends to go very low. As a South African National Blood Service, we are required to at least collect 3,500 units of blood per day. And in instances where we are not able to do that, it means that when the demand is high, we are then not able to actually meet that particular demand. And that could lead to a compromise in terms of the quality of service that is provided by healthcare professionals.
And you spoke about some of the disruption in schools, places of higher learning and education, and of course workplaces during this time.
Yes.
But just take us through the importance of regular donations, regular blood donations, and also how long is blood kept before it is no longer viable?
Okay, so regular blood donation is quite important. It's important for a number of reasons. So if your donation pool is small, as you know, the South African population, we've got only about 1% of the South African population that are regular blood donors. So that means that those people that have donated in any rolling 12-month period, right? And this is a number of challenges. As you know, as South Africa, we do face a number of challenges from health, from socioeconomic factors that may result in people not donating. So if you've got a compromised and a blood pool or people that you can donate from, it means that your regular donors actually have to come more frequently. And in coming more frequently, that can also lead to a number of other challenges. That means that people are being bled more frequently than they should. And we therefore encourage us, as we are talking now, maybe more to the youth, to actually also come in and increase that pool of people that we can donate blood from, so that we can then be able to reduce the number or the frequency in which we bleed our regular donors, right? So for whole blood collection, we encourage you to come in every 56 days. But if we had more people donating, that would be, you could just come in maybe once a year or twice a year to come and donate, and we could then have sufficient blood collections. Blood, in terms of its shelf life, so for whole blood products, your shelf life is about 42 days. And for platelets, which also the regular interval in which you donate platelets is much more frequent. Platelets last up to 5 days. So you can see that, and platelets are, it's a blood product that is required for people that are undergoing a number of medical treatments, cancers, and so forth. And that is quite, a blood product that is in demand.
And Thandi, you stress the importance of signing up for first-time donors, especially the youth. Perhaps use this opportunity just to impress upon the youth and, of course, those who may not have signed up yet, why it is so important to donate blood, and, of course, the criteria for someone who wishes to donate.
Yes, thank you very much. So the criteria for someone who wishes to donate, they must be 16, between the ages of 16 and 75. So you can definitely see that it actually covers our mature young people. So at the moment that you are 16, I think that's about grade 10 and so grade 11 going up, you can then become a blood donor. All you need is your identity document to be able to be registered on our system to become a blood donor. But I think also importantly, what is also important for young people as they start blood donation in a young age, that helps them to keep their lifestyle healthy. Because for you to be able to donate consistently, you must maintain a healthy lifestyle. And so if you know that that's one thing, that's a calling that you want to do, or that's what you actually want to do and give of yourself, and save at least up to 3 lives with every donation, you will then maintain that healthy lifestyle. And you must also have a particular weight. We're looking at people that are at least 50 kgs in weight that can then be able to donate.
Well, that's where we have to leave it. And thank you so much, South African National Blood Service Senior Manager for Marketing, Communications and Brands, Thandi Mosupye, speaking to us about the importance of just donating blood, and also, calling on those who have not yet, who are able to come forward, and imploring the youth as well to donate blood. And this as we go into the festive season.